Good day, Nathan P. Lacroix here, another installment of Insurance Talk. Let's get to it. Looking at the Wall Street Journal, even Fox News, even NPR, even the New York Times, and even CNN. This is about the Trump administration temporarily halting some payments under the Obamacare program. Other headlines read as, let's see here, from the New York Times, health insurers warn of market turmoil as Trump suspends billions in payments. From NPR, Trump administration freezes payments required by the Affordable Care Act. Trump administration takes another swipe at Obamacare, and so on and so forth. It all kind of means the same thing. There was a ruling by James O. Browning, and he essentially voided the formula used for ACA risk adjustments. We'll talk about that in just a moment. So he voided the formula by used by the federal government to calculate the risk adjustment payments each year from 2014 to 2018. The amount at stake just for 2017 here is $10.4 billion, and that goes from the government over to the insurers. How they determine this. So this is what we're going to unpack here. It's the risk adjustment program. So the adjustment of the risk refers to the insurers, where some insurers like Blue Cross Blue Shield or Health Net or Aetna or Kaiser, they sometimes, some years, they get a lot of unhealthy people. They get a lot of, cancer, pre-existing conditions, COPD, whatever it may be, where there's heavy utilizers during that year. So much so that the insurers, they actually go in the red. They spend more money in medical claims to pay those doctors and those hospitals for those services than the actual money being brought in by monthly premiums. The monthly cost to you, it costs for you to pay for your health insurance every month. So in order to help them out, what the government did was they looked at other carriers during that year and said, okay, well, were there any carriers that had, good claim history? Where they brought on a lot of healthy people, where essentially nobody sought any services over the year, and all of those monthly premiums, they went in and it didn't really pay anything out. They were in the black. They actually made a profit. What the ACA did was it actually took money from those carriers that made profit and took a small portion of that and used that money to pay and help subsidize the costs of the losses of the other insurers because of the heavy utilizers just for that year. Now every year it's different. Some carriers get some money, some carriers don't, some carriers have to pay money, and that's really how it works out. So you are adjusting the risk, hence the term risk adjustment. So every year, June 30th, the government provides an announcement to the carriers on who gets how much money. This year, instead, the insurance carriers were notified that there is going to be a halt on the actual payment because the calculation, according to Judge James Browning, it just didn't work for whatever reason. So that's the one thing that I don't know, even reading through these articles here. Didn't really specify how the calculations were insufficient. They didn't really tell us what new calculations that they were going to use, or what mathematics they were going to use to recalculate the payments that were going out to the insurers. There's also a lot of speculation that a lot of people are providing their own opinions on why they think the Trump administration is doing what they're doing. But there hasn't been any official statement as to why they're doing it, other than James O. Browning stating that the calculations are essentially void and obsolete and they don't work. So the Trump administration is really focusing on that particular ruling. So what does that actually mean? And this is where I go into my experience in the perspective of a health insurance agent, a general agency. I've worked with carriers. I've worked for carriers. I've worked with many colleagues in the industry. When it comes to calculating the premiums every 3 months, every quarter. Every carrier has something called actuaries, where they look at the risk, they look at the profits, they look at the losses. There's hundreds of calculations, and the analysis and the data that they pour over every 3 months, it's astronomically immense. And what they do is they predict what their risk is going to be over the next 3 months, over the next 6 months, over the next year and a half, to where they determine what they feel is an appropriate price for a particular plan. So let's say, they've poured over the data and they said, you know what, $500 per person for this really nice PPO policy where, it's a $15 copay at the doctor's office. That seems reasonable because of all of the data that we've poured over the last year and a half, last 2 years, last 10 years, whatever it may be. So they're doing that this year. In Q3, which is what we're in now, a month of July, the actuaries are predicting their costs and monthly premiums for 2019. What they are having trouble with is this suspension of the payment in the $10.4 billion to the health insurance carriers. They were actually counting on that money, predicting that money might come in. They were doing estimate cost of how much they expected to receive, and with that money, lower essentially the cost for 2019 going forward. Because of the halt, the progression of the calculation of the rates by the actuaries at the carrier, now they don't have that guaranteed money. So without that guarantee, they actually have to calculate that loss. They have to calculate that and just assume that they're not going to get that money, and now they have to make a decision to report that premium to the Department of Insurance and to the Department of Managed Healthcare. See, the thing is, when it comes to providing rates, it's a two-step process. A carrier like Blue Cross Blue Shield, HealthNet, Kaiser, and the like, they go through their actuarials, they come up with the data, and they provide the premiums for every single plan for every single age. Those rates are then put together in a nice, neat data sheet, and they're sent over to the Department of Insurance and the Department of Managed Healthcare. Those two regulatory administration folks, they look at it and they will approve, deny the premiums, or they'll send it back saying you need to do more recalculation, revisit, we'll re-review, and then we'll determine if those rates are appropriate. Well, this time around, they're in the process where they have to get those numbers out. They have to get them, the carriers, they have to get them over to the Department of Insurance. They have to get them over to, to the Department of Insurance and the Department of Managed Healthcare. So without that guarantee of that $10.4 billion coming their way, respectively, divvied up amongst the health insurance carriers, they are now calculating for that loss. So Blue Cross Blue Shield, in a couple of the articles, they've gone on to quote that there's going to be disruption. There's a possibility, essentially, of premiums. The increase of premiums will be just like 2013, 2014 when ACA took full effect, where you saw 120% increases in some cases. Between 75 and 120% was the average that people saw during that time. So this time around, people are fearing the same thing, but again, we do have to state, this is just a halt. We don't know if this is going to be completely done away with. And again, we don't know if there's going to be a new calculation put in place of the old calculation. We don't know if this ruling will be overturned. So there's still a lot of unanswered questions, but from my perspective, and this is my opinion here, I think we can all agree that access to affordable health care is just a human right. That what we want as a health insurance agency, as a general agency, as people in the insurance industry that are working hard to make sure that people like you that are struggling with the health insurance concept and trying to wrap your head around this fluid market right now, we're out there, we are fighting for your best interest. You know, we want what's best for you, we want what's best for us. We want to make sure that you are being taken care of at the most affordable level. And with that, we're doing everything we can by providing you education, by giving you perspective, by giving you insight to these articles. I urge you to do your own research as well, but more importantly, talk to us. Go to lawwho.org. I'll have links in the description. Talk to an agent. They're more than happy to answer any questions that you have. What I don't want you to do is go onto Facebook or go onto Twitter and have somebody that knows nothing about the health insurance market and either make accusations or spread rumors. There's a lot to this than just somebody making a tweet and suddenly everyone knows everything about it. We want to share with you how we're working towards our ultimate goal, which is, again, affordable health care for everyone, so that way you no longer have to worry about should I pay my mortgage or should I pay for health insurance. That's nothing that we want. We want to share with you what we're doing in the market, and I'll share with you what I'm trying to do as well to make this a better life for everyone. So that's all I've got. Again, Nathan P. Lacroix, Insurance Talk. Go to nathanplacroix.com if you're an insurance broker and you're looking to take a look at growing yourself, growing your business, growing your media. I've created a 12-step program. These are just the tips of the iceberg. If you want to know the true secret, again, it's all free. Please contact me and I'll be more than happy to share with you some ideas on how I can grow your business and share with you what the real secret is, which is working directly with me. Thank you for your time.